Welcome, hi! I'm Janine, I'm campaign manager here at UICC, and I'm here today to kick off the third and final year of the World Cancer Day campaign, Close the Care Gap. And this year, we're giving the campaign a bit of a different flavor because we will be connecting live with Dakar, the capital of Senegal, where my colleague Laura is attending the 14th Aortic International Conference on Cancer in Africa. So make sure to stay tuned for later. And I would also love to see your comments in the comment section below and just to know how you're doing, where you're joining from today, and then maybe also ask some questions if you have any. World Cancer Day is one of the leading global health awareness days, and it happens every year on the 4th of February. It is a moment for all the voices to unite and to stand in solidarity with everyone whose lives have been touched by cancer, both past and present. World Cancer Day 2024 is exactly 89 days away, so it's really not that far, and it's time to get down to business and start planning. And that is what I'm here to do today, to help you. So we will talk today about what the focus will be for this last year, 2024, and also to discuss some of the ways that you, our members, our partners, and our supporters can engage with the campaign. As you probably know by now, the 3-year campaign is putting a spotlight on the urgent need to address inequities in cancer care and to make the entire cancer care continuum inclusive. And the tagline is Close the Care Gap. For World Cancer Day 2023, so this past World Cancer Day, we focused on celebrating real-world progress and look at all the actions that are already happening around the world to address these inequities. But now it's time to pay attention because now we are getting ready to take it up a notch. We are literally taking it to the next level. For this last year, we are asking world leaders, governments, to address the inequities in cancer care because they also have a really important role to play and they also have, something to do with this. So now that we brought this issue forward, and now that we have an engaged community by our side, thanks to you, we are ready to push for this bold action. So you might want to know, what is this call to action exactly? What does it actually entail? The Union for International Cancer Control, which is the organizer of World Cancer Day, encourages everyone to ask their governments in a letter to improve health equity and to make it easier for all populations to enjoy affordable and accessible cancer services and to reduce disparities in cancer cases and mortality. We have an extraordinary opportunity to accelerate progress toward this goal, but only if we act together and only if we act now. I want to know, are you guys in? Now you might want to know how to do this. And the really good news is that it is super simple. We made it so simple for you. All you have to do is go on worldcancerday.org, call to action. I think the link should appear below, where you will see the letter. Then all you have to do is put in your email address, your first name, your last name, and the country you live in. And this will automatically populate with the name of your health representative. Then all you have to do is add your voice, click the button, add your voice, and that's it. That's how simple it is. And we just wanted to make sure that you get this step by step, so we recorded a quick video for you. Please share the fact that once you joined this call to action, Make sure that you share it with your friends, with your colleagues, with your network as widely as possible. And if you want to know more about what's written in that call to action, please make sure to check out the website. Everything is there in detail, so you can really know what you're signing, basically. I also wanted to say that we saw you joining from Malaysia, from Iran, from South Africa, so hello, and also Turkey. And I know that there's also some comments already, so wanted to just say hi, a little shout out to you. And moving on, I wanted to say that we actually launched this call to action already a couple of weeks ago at the World Cancer Leaders Summit in LA, where Miriam Mutebi, our UICC board member, signed it. So Laura was able to speak to her at the Aortic conference just now about the importance of World Cancer Day, but also why she then went ahead and joined the call to action. So we recorded a quick video from her also at this conference, so I apologize in advance for the sound. It's not that great, but we thought that the message was important enough for us to share it with you anyway. So here you go. Over to you, Miriam.
Hello everyone, my name is Miriam Mutebi and I'm the President-elect for the African Organization for Research and Training in Cancer and a board member of the UICC. Now, 4th February, World Cancer Day, is really a chance for us to really think through the emerging crisis that we are seeing in our populations and the fact that we are seeing an increase in the number of patients diagnosed with new cancers, especially in low and middle income countries. This year's theme, Close the Care Gap, really forces us to think about what are the issues that are pertinent to all the patients, irrespective of where they are in the world. And that is, where you live should not determine if you live. This year's theme, Close the Care Gap, is an opportunity for all of us, stakeholders, opinion leaders, policymakers, caregivers, healthcare providers, civil society, the public, patients and patient support groups to really think through how we can improve access to care. And access to care doesn't mean just access to treatment, it's access to diagnostic capabilities in order to facilitate timely diagnosis and referrals. It is access to treatments on all the aspects that entails, whether it's surgery, whether it's radiotherapy, whether it's chemotherapeutic agents. It also includes access to survivorship and supportive care, which really includes palliative care, psychosocial services and psychological support. So it's really thinking through how do we get together as stakeholders, as invested people invested in making a difference to really change the lives of our patients. This year, let's reflect on the theme and really work towards closing the care gap. What can one do this World Cancer Day? Sign the World Cancer Day call to action to really start the first steps towards raising awareness among all our policymakers and stakeholders to start to impact our patients. I've signed it already. Have you?
Thanks, Miriam, for the shout out, and thanks for taking the time to speak to us and record this message for us and to support World Cancer Day and the call to action, of course. I think the moment has come that I'm really excited about because we're going to join Laura, who is waiting for us at the Aortic conference. She's ready to talk to us. I think she's on standby, so let's make sure she's here. Laura, are you here? Can you hear me?
Hello, Janine. Hello,
Hi,
everyone.
Laura. Nice to see you.
From Senegal.
How's it
How are
going?
you? Well, apologies for the background noise. This is a very busy convention center here at the Aortic Conference for Research and Cancer in Africa. But I'm very, very happy to be able to join you. So I hope that this noise doesn't stop the message that our African community is part of this kickoff today.
It's amazing to have you here online, Laura, but honestly, I'm really missing you here right next to me. This is where you usually belong when we kick off a campaign, but I understand it's important, and it's also really nice to see you in the field, so to speak. And I was just kind of wondering, have you been able to speak to some of our members about World Cancer Day, but also more specifically about the call to action?
Yes, it's a big yes from me because not only we've been talking about obviously UICC and all the work that we do here in with our members in Africa, but the call to action for World Cancer Day World Cancer Day has been like a really big success. We handed these cards. I think I may have like just a little left for the rest of the day. That means that everyone is joining the call to action, talking about it, spreading the word, and that is like music to our ears, really.
That's amazing to hear. That's really wonderful.
It's actually, we went even a little bit farther because we wanted to make sure that you knew what we were talking about. And I've been speaking with some of our members and active parts of the community here from Africa, and we recorded some testimonies. So I think we should let people see what we actually talk about and how people are taking on the call to action.
Yeah, I agree. That's really amazing. All right, let's see what our members have to say.
I have signed the call for action for the World Cancer Day, and I'm asking you to also join me in signing this call for action. Why did I do this? I would like to see a comprehensive cancer care package, and this cancer care package will be good because it will also include diagnostics, where patients with cancer will be able to go for regular screening for surveillance tests. And with diagnostics included, it makes it easy for them to go for that. It will also encourage those without cancer to also go for early screening because diagnostics will be covered by the Social Health Security. Number 2, I would like to see government decentralized comprehensive cancer care, so that cancer care is covered in the regions and counties where people come from and they don't have to travel for long distances. And number 3, communication about cancer at the community level in a language and in a way that the local community can be able to understand. Thank you very much.
So I have signed it for the World Cancer Day call to action for only one reason. I want to see policymakers in all the conferences of oncology, because scientists brings a lot of great advance into the field, but unfortunately this is not changing our practice because policymakers are not here. So please join all the meeting of oncologists so we can work together and bring new advances to our patients with cancer.
I've signed the call to action to close the care gap for cancer patients. This, I believe, we can do through making sure that patients everywhere in the world have access to essential quality cancer medicines when and where they need them. Thank you.
And I'm signed for call for action for the World Cancer Day because in our country we have a saying, when you are well, you belong to yourself. When you are sick, you belong to your family. And it's really imperative to understand there is key action need to be taken to close the gaps, especially in palliative care, cancer prevention, cancer treatment, cancer care, and cancer in general. Because the way the patient died can reflect how the society is. So please take an action now. Thank you.
The way a patient dies reflects how a society lives. What a powerful statement. Don't you think, Laura? That is just, wow.
Absolutely.
It's, wow. I wanted to thank all our members who took the time to record this message for us, to support World Cancer Day and close the care gap, close the care gap and the call to action. And also just, I know that without our members, World Cancer Day wouldn't be as successful as it is. So a real huge shout out to our members, also to those who have joined online. I saw that Kansa joined. I also saw that someone from Papua New Guinea joined, so hello. So just really happy to see all the support already happening for this call to action and for World Cancer Day.
Yes, I love that we were able to show a little bit of those voices that we are hearing here face to face in Senegal during the aortic conference. Like, it has been an absolute pleasure to really get to hear those first reactions to the call to action. I think it's going to be really taken on by our community, and this is how we spread the word. We will have more activation of the campaign in the month of November with our members and our community. And I'm so happy that I had the opportunity to be here and share that with you, Janine, and with everyone. So I have no words to say how exciting this is, and really the campaign has been an absolute success here in Senegal.
Thank you so much, Laura, and also thank you for taking all this time at your conference. I know you're so busy with lots of other things, so I wanted to say thanks to you and also the UICC team there on the ground to make this broadcast happen over there. So thank you. Bye.
Thank you. Bye from Senegal. Take care. Bye-bye.
All right. So we have some other important grounds to cover. As you know, World Cancer Day, the hub for all the information is the dedicated website, which is worldcancerday.org. This is where you can find all the information related to the campaign. You'll find cancer campaign material. You'll also find just information about cancer in general. You find lots of ideas of how to engage with the campaign and how to get involved. So yeah, don't hesitate to go and check out our website, please. In order to promote our call to action, we are working on a really exciting social media idea with the goal to have as many people sign up as possible to the call to action. The code word is universal invite, but I shall not say more at this stage. We will let you know more when we're ready to go live with it. So just make sure that you keep a watch out on our website and also our social media channels. This is where we will communicate all these exciting activities happening. So besides the World Cancer Day call to action, we're also running the World Cancer Day 5K challenge, where, if you remember, we are inviting everyone to close a loop of 5 kilometers by running, cycling, hiking, swimming, doing the handstand, whatever, and then to invite 5 friends to do the same, and then to also join the call to action. We are counting on you to make this another global success. And then whether you are planning on organizing an event, a panel event, or if you want to join the 5K challenge, or whether you are simply sharing your cancer story with us, please do not hesitate and do not forget to add that as an event on our map of activities. We need you to do that so that we can keep an eye on what's happening around the world, so we know what's going on, right? We want to know, but also so that you can inspire others to do the same and serve as a role model. Yeah, and you know, the more action around World Cancer Day, the better for everyone. Another super important point that I really want to raise here is that we have plenty of content that's ready to use for you. So to find these, all you have to do is go on the library. So you click materials, and then that's where you find the library, where you will find the how-to guides, World Cancer Day and Close the Care Gap logo files. You will find media banners. You will find infographics, action toolkit, campaign posters. You see here behind me, these are the campaign posters for this upcoming World Cancer Day. Very colorful. I'm very excited about it. And I also wouldn't want you to miss out on the option to create your own custom poster. And just to make sure that you know how to make one, we created a video just for you. And when you print this out, this is the result you're getting. Here is a custom poster with our CEO, Carrie Adams. So this is what happens when you create your own custom poster tool. So all of these materials will be available in English, in Spanish, in Brazilian Portuguese, French, Russian, Arabic, Chinese, and German. Whew, I feel like I've covered a lot of grams just now, so I feel this is also a really good moment to look at what are some of the questions that we've received. So let me glance over there to see what's happening. All right, so one of the questions is if the call to action is only available in English. And of course, my answer is no, we have thought about this. So the online letter form is available in English, French, and Spanish, which is also, you know, the versions of our website. But we also make available the letter in PDF form in additional languages such as Brazilian Portuguese, Russian, Arabic, simplified and traditional Chinese, German, Japanese, and Korean. So you'll be able to be covered with all these languages. And another question is, how can I get involved as an individual? Well, very simple. You can, of course, send your own call to action to your health representative. So that's one thing. And then you share it as widely as possible on social media. You ask your friends and family to get involved as well. You can also take part in the 5K challenge and make sure to tag us. All of this information is available on our website, Take Action. And then we have another one, which is it possible to share the call to action on social media? Yes, absolutely. Once you run through the form, there'll be a window where you have the choice to post to social media. But we're also making available lots of social media material that you can use to then post it on your channels. And don't forget, the custom posted tool also has a message already in there, a ready-made message that says, I joined the call to action, will you? So that's another way for you to take part as an individual in the campaign. And I also wanted to take this moment to wave hello to Femama and to our members in the Philippines. So hello, really great to have you here on our live stream today. And I think that was it in terms of questions. So thank you so much for joining us. We hope that you will use this campaign to make it really your own. Own it. It's your World Cancer Day. We are here to support you with it. And if you have any more questions, please don't hesitate to write us at hello@worldcancerday.org. But before you go, we are excited to share with you the official launch of the campaign video. Sorry, I'm getting one more question in from our social media. And yes, we are going to have new social media infographics. They will be uploaded very soon, so keep an eye again on our materials page. It will be there very shortly. We're just updating some final little details. But yeah, so thank you again to, before we go, we have this video to share with you. And thanks again to our members and to our World Cancer Day supporters and to the 3 special guests who appear in the video. Your support means the world to us, and I really hope you enjoy it. Bye.
Far more unites us than divides us.
We live, we love, we learn, we work, we play, and we get sick.
Anyone can get cancer, but not everyone has the same access to cancer care.
This can change. It must change.
World leaders, those with the power to make that change, need to hear our message.
We need your help to make sure it's heard.
There have been incredible advances in cancer prevention,
Diagnosis and treatment for some,
but not for all.
income, education, geography, and discrimination can all affect the treatment and care we receive.
Differences exist between countries, across age groups, and inside the borders of all nations, wealthy and poor.
Where you live, who you are, who you love, it makes no difference to cancer. Why should it make a difference to cancer care?
United, we can tell governments that this matters. Together, we can be a part of the solution.
Will you add your voice?
Demand equity for cancer care and help us close the care gap.